Eye surgery is one of the most delicate and fascinating procedures in modern medicine. Inside the small, fragile space of the human eye, surgeons work with extraordinary precision, often using microscopes, lasers, and microtools finer than a strand of hair. This operation begins with a careful inspection of the cornea, lens, and retina. Every movement is calculated to protect the structures responsible for vision, our most relied-upon sense. As the eyelid gently opens, the surgical team stabilizes the eye. Under magnification, the surgeon creates a tiny opening in the cornea, smooth and almost invisible to the naked eye. Through this microscopic gateway, specialized instruments enter the anterior chamber. A soft glow reflects off the natural fluids inside the eye, highlighting its transparent layers. If the surgery involves the lens, precision tools break down and remove the clouded or damaged areas, preparing the eye for a clearer path of vision. In retinal procedures, the surgeon carefully repairs the light-sensitive tissue at the back of the eye, working millimeter by millimeter to restore function. The retina's intricate network of vessels and photoreceptors lights up under the surgical illumination, guiding each exact motion. Throughout the surgery, every heartbeat, every pressure change, and every micro-movement is monitored to ensure safety and stability. As the operation concludes, the tiny incision seals naturally or with minimal assistance. The eye, once clouded, strained, or damaged, now begins its journey toward healing. What happens next often feels miraculous. Colors become brighter. Shapes become clearer. The world appears sharper than it has in years. Eye surgery doesn't just fix a problem, it restores connection, clarity, and confidence, allowing patients to see life through a renewed lens.